But the month of September, as we make our way to the month, is really pain management month. It's pain awareness month. And millions of Americans deal with pain every single day.
You know, I used to have terrible neck pain, and it becomes the only thing you can think about. Even with 3 little kids and things to do, I couldn't get my head around anything but how much it hurt.
How did it eventually go away?
Well, I had to seek medical treatment twice and get some injections, and it worked, and I'm good now. But like when you can't focus on anything else, and that's it really affects your life and the lives of those you love too.
And like back pain is almost the worst as well.
Yeah.
Yeah. So I may be a pain in your back.
I was going to say.
Yeah, you're going to say that.
My ex-husband had a lot of back pain. It might have been me.
Come on, that's not true. All right, well, I did stop over to Integrated Pain Associates, and we learned one method that can alleviate pain. Check it out. And joining me now to talk about spinal stenosis is Dr. Lowry here at Integrated Pain Associates. A lot of people complain, hey, their back hurts, they can't stand up, they can't walk.
Absolutely. It's the main cause of pain in the United States is low back pain. It's estimated about 10% of the population will suffer from spinal stenosis at some point in their life. So quite a few people are affected by this.
If someone's not familiar with spinal stenosis, let's give us the medical definition of that.
Certainly. So spinal stenosis is an area of the spinal column itself that is narrowed and puts pressure on the spinal cord when we're standing and walking.
Okay, so if you're on your feet for a long period of time and you start to get pain in your legs, your lower back, that could be a symptom that you could have spinal stenosis.
That's exactly correct. In fact, that's the main symptom that we see is patients having difficulty standing and walking for any extended period of time before they start having pain that radiates from their back all the way down their legs.
There you go. So you might have seen maybe some elderly people bent over. It's to alleviate the pain, though, right?
That's exactly correct. They typically walk with a stooped posture. They're frequently leaning on a walker or a shopping cart and just have difficulty standing upright altogether.
So the procedure that you guys do here alleviates the pain coming from that pinched nerve, is that right?
That's correct. In fact, it's typically a single nerve root on the side that comes out of what's called the neural foramen, or all of the nerve roots in the spinal canal that can be compressed centrally. And so what this device is just a simple spacer that goes in and keeps pressure off those spinal nerve roots to prevent them from getting pinched.
Now, how long does this last? Is this something that could 5, 10 years, or?
Absolutely. In fact, we have data out past 60 months or at 5 years that shows significant improvement in not only patients' pain but actually their functional capacity. So we see significant improvement in the ability to walk, to stand, to just take part in your daily activities like cleaning your dishes or cooking your own food.
Yeah, I agree. And also, I guess a bigger picture is it gets people away from being opioid dependent.
Absolutely. You know, in fact, we see a lot of patients here, and that's really the only reprieve they've known for a long time is just their medication. So to offer them something different is really what we're striving to do across all fields of medicine to do our part to prevent further opioid crisis or opioid addiction.
And that's something that's been in the news is people addicted to opioids.
Yeah.
And
it's terrible.
And procedures like that can get people off of pain meds. You know, I gotta say, as I approach 50, which I'll be 50 November 1st, I have felt my body change, obviously.
Oh, yeah.
You know, joint pain, arthritis, thank God nothing outside of that, but it's just a part of, I guess, getting old.
It is. But you were saying like some dietary changes were beneficial to you, and I'm a big believer in that.
Yeah,
too.
I cut out soda in my diet, and I almost immediately saw a reduction of
fascinating.
It is fascinating. What you put in your body does absolutely affect how you feel. Go check those guys out, though. That procedure, I love the video that we had on there.
Me too.
Go to the website right there and check it out. And if you know someone who suffers from back pain, spinal, if they're just in overall pain, there is some great methods to help you do that as well.
Get some relief.